Behind the scenes, behind the lines, inside the stories others won't tell. The Morning Insiders.
Skipping medications, stressing about paying rent, money trouble at a Chicago nonprofit led whistleblowers to contact the Morning Insiders for help.
Yeah, Lauren Victory digs into a twisted tale of finger pointing with social workers caught in the middle.
The joy of giving back doesn't stop after the holiday season.
I love my job.
At least not in the case of this anonymous social worker. Every day, she treats some of the city's most severe mental health challenges. So does this therapist.
The people that we are serving, many of them would end up homeless, incarcerated, institutionalized, or worse.
Their nonprofit is called Community Counseling Centers of Chicago, or C4. Despite decades in operation, along with 7,000 clients and counting, confidence in leadership is dropping.
I'm trying to remember which came first. It was the late paycheck.
Recent emails about delayed payroll were followed by an announcement about upgrading to better benefits in 2020. Just one minor detail.
By the way, until then, you'll have to pay for COBRA.
COBRA is a government health insurance program that's notoriously pricey. C4 clinicians say they had 12 hours notice of the change, but it took a month to materialize.
When I have tried to fill prescriptions, I've been told by the pharmacist that I do not have health insurance. There were employees who were rationing their medications to make it last longer.
And now a third hit. Getting paper paychecks without a list of deductions to explain why pay is lower than expected.
I don't know what's going on. I guess that's the big question.
We tried to track down C4's CEO, Chris Carroll, to ask about financials.
I did tell him I was coming.
Okay, so he's not here yet, so I can't let you in, okay?
Okay. There's nobody else I can talk to?
No.
Later, he sent us a head-scratching email with several statements directly contradicted by our reporting. Quote, the state and MCOs, including County Care, currently owe C4 more than $1 million in unpaid claims, he said. They are not owed anything, County Care tells us. The Illinois Comptroller's Office confirmed the same. We asked Carroll to send us invoices showing missed payment, but he never did. As for the dropped benefits debacle, ADP Payroll Services abruptly canceled its contract without warning, even though premiums were fully paid, Carroll wrote. But ADP told CBS 2 the opposite, that they'd communicated for several months with C4 about repeated failure to provide timely funding.
Is it just gross mismanagement?
It's unclear. Carroll denied our repeated requests for an interview. In the meantime, employees fear the unknown for themselves and for clients.
If you don't care about those people's lives, then I would imagine you would at least care about the taxpayer dollars that are being saved by keeping people out of institutions and from being incarcerated.
Lauren Victory, CBS 2 News.
C4 management warned staff about our story in an email and once again blamed funding problems on ADP and the state. The CEO would not respond to our specific questions about the discrepancy between his money explanations and everyone else's. Social workers tell us their medical coverage finally kicked in late last week.